today it's an honor and it's a privilege. And I'm not sure whether this kind of program for the senior population has been conducted anywhere in Orange County before. It's been very difficult to get an expert to do this program, and today we have the expert in Orange County relative to the research that's being conducted in the use of cannabis and cannabis products. Dr. Brent Yeung is a graduate of UC Berkeley and had a degree in economics. He did his medical training at Georgetown University in Washington, D.C. He did his anesthesiology residency at Georgetown University. He did his pain management fellowship at UCI. He has clinical expertise and has done research in pain management with cannabis and safety, the formulations, the proper use, and as an alternative for opioids. So please welcome Dr. Brent Yeung. Brent?
Hello. I just wanted to thank Dr. Lawton for inviting me here to speak with you and for the Elks Club for hosting this event. So today we'll be talking about a topic that is of very interest to me and probably to all of you as well. You've probably seen in the media that there is a large proponent of the population that is interested in cannabis and its use as a medicine. I am going to be hopefully covering as many topics as I can that are relevant to you in terms of the clinical implications of cannabis and how we can safely use it. So before I actually get started, Dr. Lawton asked me to make sure that everybody holds their questions till the end, if at all possible. Disclosures, I have no disclosure as I have no financial ties to the cannabis industry. Let's see here. So objectives for today. Mainly what I'm wanting to talk about is I want to give you a brief history of cannabis and its use in the past and in ancient times and now. I'm going to talk about the regulation of cannabis, the laws a little bit. I'm going to go over the endocannabinoid system, which is the system in our bodies that cannabis exerts its medicinal effect on, and how does it change our physiologic function. I'm going to be talking about the major cannabinoids of interest, specifically THC and CBD, which is tetrahydrocannabinol and cannabidiol. I'll be talking about clinical conditions that I hope are relevant to you, and then I'll be talking about the routes of administrations, how people typically consume cannabis, and as well I'll be talking about future areas of research that we're conducting at UC Irvine. So the brief history is that this is in 2700 BC, Chinese Emperor Shang was the first documented emperor to use cannabis for medicinal purposes. What they used it for back then was for gout, for autoimmune disease, inflammatory conditions. Later on, it traveled its way down the Silk Road into India, where it was used for pain relief and women who were undergoing childbirth, people who had severe headaches, insomnia. Later on, it made its way to Egypt in about 1600 BC. It was used for eye-related pain like glaucoma. And then more recently, it came to America. And it wasn't until the 1600s when it came to America, and it was primarily used as used for its fiber, and it was used to make clothing, textiles. But in about 1850, between 1850 and 1942, it was the most commonly used medication in the United States. And it was used for more than 100 different medical conditions. But in 1970, it became illegal, became a Schedule I drug, which means that the federal government made it so that they said that cannabis has no medical use, it has no acceptable safety profile, and has a high potential for abuse. And this has been disputed since 1970 up until now. And currently Congress is trying to enact laws that will make it more acceptable, at least for medicinal use. These are the cannabis laws by state. As of the midterm elections in November last year, 33 states and the District of Columbia have passed laws to make it legal for medical use in some form. In addition, 10 states and the District of Columbia have made it legal for recreational use. In California alone, it was the first state to make it legal for medicinal use in 1996, and then recently in 2016 they passed legislation that made it legal for recreational use. Now, the laws have changed. The federal government still says that it is illegal for use in any form. But the states are allowing it to be used legally. And there's this gap between the amount of people that are using cannabis, either for medicinal use and recreational use, and the research that's being done to make it legitimate for its use. And the federal government has really put a lot of restrictions on the research that can be done and conducted on cannabis as a plant. So there's this gap between the amount that's being used in the public and what our scientific knowledge of the compounds are. And what we're trying to do is try to close that gap so that we can inform people, the public, patients, how we can responsibly use cannabis going forward. So I'm just going to go over some of the terminology just to clarify what the different terms, the different components of cannabis are. So the first common misnomer is marijuana. So it was popularized in the 1930s when there was a large push to make cannabis illegal. And it was popularized by Harry Anslinger, who later became the first head of the DEA. Marijuana is actually a slang Spanish term for cannabis. The proper terminology is cannabis. It's its scientific name. The genus name is cannabis, and there are subspecies called indica, sativa, or ruderalis. It was named by Herodotus, the Greeks, in the early 400 BC. And the other common terminology for cannabis is hemp. And hemp is really used for its fiber, and it's got a THC content, which is one of the main components of cannabis, of less than 0.3%. Mainly it's used for its fiber, grown for its seed, used as an industrial product, and it's been used commercially for more than 12,000 years. So the effect that cannabis has on the human body is exerted by basically taking advantage of this endocannabinoid system, which involved in our normal physiology more than 25 million years ago. So we know that this system is present in all animals with vertebrae, over 600 million years ago, I'm sorry. It's absent in plants, animals that don't have vertebrae. And we know that it was present way before the plant came into existence. So the plant came into existence about 25 million years ago, and this endocannabinoid system that's in our bodies evolved over 600 million years ago. So we know that there's actually cannabinoids or endocannabinoids that are being made by our bodies normally that control function of our normal human function. This is the endocannabinoid system, and it's mainly consisting of these two different type of receptors, the CB1 receptor and CB2 receptor. It has a role in these human functions, and mainly it has its role in making sure that we're regulating feeding, either exerting feelings of hunger, feelings that you need to eat, or feelings that you've eaten enough. It has a role in energy metabolism. It has a role in how your nervous system works and how your brain functions. It has a large role in pain and how our brains experience pain. It has a role in our autonomic function. It regulates our blood pressure, our heart rate. It has an effect on our immune system and how we fight off disease and infection. It has an effect on connective tissue repair, so healing, and it also has an effect on our behavior. So the cannabinoids in general consist of three different types. So one is the endocannabinoids, the cannabinoids that we normally make in our human body. And regulate these homeostatic functions of, that I just listed before. There are synthetic cannabinoids, so cannabinoids that we make in the laboratory that we can give to patients. And then there are phytocannabinoids, which are naturally occurring cannabinoids in plants that grow in plants, and then we can extract those cannabinoids and can give it as a medicine or a recreational drug. The two major cannabinoids that we have studied and know about and are of the greatest percentage in the plant are THC and CBD, which is tetrahydrocannabinolic acid and cannabidiolic acid. But there are more than 80 minor cannabinoids that we don't really know very much about and we haven't done very much research on. And we continue to find more cannabinoids in the plant, the more that we research the plant. The terpenoids are things that give cannabis its characteristic smell, but really doesn't have any physiologic function. So these are the different molecules. This is the molecule of THC. It was discovered in 1964. It mainly contributes to the psychogenic aspect of THC, so the feeling of feeling high when you're consuming cannabis. But it is thought to have the analgesic component, or it is known to be a pain reliever. One of the things that it does is it also is converted into a form of THC that really gives you that high feeling, and it can give you it can cause a psychogenic effect. The other major cannabinoid is CBD. This was discovered a little bit earlier in 1940. It doesn't have any of that psychogenic effect. It doesn't make you feel high. It can make you feel relaxed. And it is a component of the plant that helps to modulate some of those unpleasant effects of THC because it blocks formation of THC in the liver. It helps to mitigate the effect of THC, those unpleasant side effects like anxiety, panic attacks, or paranoia. And it also does have the potential to work together with THC to provide a therapeutic effect, depending on what you're looking for. So the chemical profile of cannabis is mainly the effect of the cannabis product that you take is mainly due to the concentration of THC to CBD. There are more than 600 different strains of CBD now, and it's continuing to grow as people are cultivating it and crossbreeding different species. So really the strain names that you see like indica, sativa, ruderalis are not quite as meaningful anymore because of all the hybriding and crossbreeding of the strains. So some of the clinical effects of cannabis, what are the potential benefits of cannabis? So we have very good evidence that it is a good antiemetic, or it helps with nausea and vomiting. Marinol is a synthetic cannabinoid that has been approved for chemotherapy-induced nausea and vomiting. Another clinical benefit of cannabis is anorexia. So it helps to stimulate your appetite. And it's indicated in people who have anorexia due to HIV or AIDS. But it also produces and stimulates appetite in other conditions as well. Another benefit to cannabis is its use in multiple sclerosis patients. It's been known to have anti-spastic, so people who have multiple sclerosis sometimes have a lot of spasticity, and they're very rigid in their muscles. And so cannabis can have a very good effect at helping to relax the spasticity in patients who have multiple sclerosis. And it's been now FDA approved as an anticonvulsant for epilepsy in children for very rare forms of this epilepsy called the Dravet syndrome. The other effects that it potentially could have is it could potentially be neuroprotective and also have anti-tumor effects. These two at the bottom here are currently being researched, and more data needs to be found to prove that it has an anti-tumor effect or it is neuroprotective. But at least in preclinical models, like in mice, it has been shown to be protective in the brain, and also some effects, some anti-tumor effects have been shown in preclinical studies. So, me being a pain doctor, this is a question that I always get from patients. It's how is it going to help my pain? And most of the studies, again, are in preclinical studies because there's not as much federal regulation on cannabis and giving it to mice, but the federal regulation is much more stringent when we're giving it to humans. But we believe that its role in treating pain is due to its effect on the endocannabinoid system, the CB1 and CB2 receptors I talked about earlier. These are just a couple of scientific research that's been done on different types of pain. There's more evidence to show that it helps with nerve-related pain. So people who have peripheral neuropathy from specific types of diseases like diabetes or HIV or chemotherapy-induced neuropathy. There have been studies on fibromyalgia and shingles-related pain. And although most of these studies have a very small sample size, between 20 and 30 patients, the combination of all these studies does provide some significant evidence that it helps with nerve-related pain. There's more research being done to look at different types of pain, like pain after surgery, pain after having a traumatic, bone fracture, but there needs to be more research done in those areas. This is just an article that was published last year in orthopedic trauma. So more people are using cannabis to treat their pain, particularly in the recovery period. So about 14% of patients that were going into trauma centers are using cannabis to help with their pain after traumatic fractures. And I don't know if you can see the numbers here, but 90% of those patients believe that it was helping with their pain in addition to the standard pain treatment that they were receiving. So this is just showing that more people are going to be using cannabis for pain, and they're going to be using it for all sorts of pain conditions, not just nerve-related pain, but also pain from surgery or from a trauma or fracture. So that is pain, but I know that there are a lot of other questions that we have about cannabis, and how does it affect our respiratory system, how does it affect our cardiovascular system. So the evidence that we have right now on the respiratory system, and specifically lung cancer, I know that's a question that I get a lot of, is it going to increase my risk of getting cancer? So of the studies that have been done, there is no significant evidence to support any correlation between smoking cannabis and lung cancer or any other cancer's development. And this is a very large study. It looked at almost 5,000 people to see if there's any evidence to correlate cannabis smoking and lung cancer. It does have an effect on the respiratory system, and not particularly in cancer, but it does cause chronic bronchitis, and it's very well documented and known that it can cause chronic bronchitis, at least while you're continuing to smoke it. And we believe that it has to do with the heat that's involved with smoking cannabis. So as you're inhaling that hot air, it's going to irritate your lungs. So there is substantial evidence that it can cause chronic bronchitis when you are a chronic smoker of cannabis. However, that resolves when you stop smoking cannabis. So it only really occurs as you're continuing to use cannabis and inhaling it particularly. It doesn't have this effect when you're taking it in other forms like sublingually or with oil drops under your tongue, or if you eat it, or if you use it topically. So what is the effect on the cardiovascular system? So it's very rare for somebody to have a myocardial infarction or a heart attack from using cannabis. There's very limited evidence to show that it causes MIs, but I did put this slide up here because in the abundance of caution in using cannabis, there are some reports that show that using cannabis has precipitated a myocardial infarction. And that is something that usually occurs because THC, what it does is it really dilates your veins and your arteries. And what that can cause is it can cause your blood pressure to come down a little bit. When your blood pressure comes down, your heart tries to make up for that decrease in blood pressure by increasing the heart rate. When you increase your heart rate and you potentially have other cardiac diseases, possibly undiagnosed cardiac coronary artery disease or undiagnosed heart rhythm or abnormal heart rate or heart rhythm, it can precipitate having an MI. Having said that, it's very rare for this to occur. It usually occurs when people have used it for the very, very first time, so their body isn't used to cannabis. This has not been shown to be the case in people who use cannabis chronically. So your body kind of adapts to the effect of the THC on your blood vessels over time and doesn't have this effect if you use it for chronically. The other effects that I thought were pertinent is the cognitive effects. And the cognitive effects have been studied for a long period of time, and we do know that there's evidence to support that at least when you're using cannabis, it affects your learning, your memory, and your attention. So,
for good or bad?
yeah, for bad. So it affects your ability to learn, it affects your short-term memory, and it also affects your ability to maintain your focus and attention on something. So we know that because of these cognitive effects, it increases your risk of getting in a car accident by at least double. And that's an area that is of utmost importance now to the California Highway Patrol, because there's now a lot more people on the road that are using cannabis and driving. But there is no real good way to identify whether or not somebody is actively using cannabis. So it's a very hot topic now to make sure that people are safe when they're using cannabis. So I can't go over all of the adverse effects, but this is a nice little slide that shows that all of the different types of adverse effects that cannabis can have. On there, we have bronchitis. It can cause you to feel lightheaded, and that's most likely due to the decrease in blood pressure. It can cause you to have panic attacks. It can cause you to have anxiety. And these adverse effects are mostly due to the component of THC. The elevated level of CBD in whatever cannabis product that is taken usually helps to mitigate some of these adverse effects, particularly anxiety, particularly the sedation, the response to light, the dysphoria that people feel when they're taking products that have high levels of THC in them. And then there are other safety factors that we need to take into account, because people aren't just taking cannabis, but they may be taking a lot of other medications as well. There hasn't been very much or a lot of research done on the drug-to-drug interactions, but we do know that THC and CBD affect the way that drugs are metabolized by our bodies by affecting liver enzymes. This is just a list of some of the interaction studies that have been done, and again, some of these are just case reports where there's just been one or two documented studies, and then there are some that have had a little bit more rigor, and the patient population is a little bit larger. But for these medications, if you are taking them, it is important to consult with a physician to make sure, and if you're interested in trying cannabis, it's important to consult with a physician to see if there are any drug-to-drug interactions. Most likely, many of the drug-drug interactions haven't been studied, but there is a good list of drug-drug interactions that at least have had a couple of case reports that have been done, and there has been documentation of some of the alteration of the metabolism of certain medications that you may be taking. So what are the contraindications? So there are absolute contraindications, which means that you should not take it if you have these other medical conditions. So if you have a condition like a psychiatric condition, like schizophrenia, or if you have acute psychosis, or an unstable psychiatric condition like depression or bipolar, cannabis can make your symptoms worse. So we always tell people who have unstable psychiatric conditions not to take cannabis, specifically THC. The other relative contraindications I did speak about, mainly cardiovascular, people who have liver, kidney disease. We want to use extreme caution before we tell people to try cannabis, and it may make a irregular heartbeat worse. a lot of the questions that I also get are, how should I take cannabis? What are the formulations that I should be using? So on the left are the ways that, the common ways people consume cannabis. So we all know that the most common way is by smoking it or vaporizing or inhaling cannabis. Other ways are eating it, dropping oil underneath your tongue or letting it absorb in your mouth. And then the other ways are using it topically. Each of these forms of administrations have their own pluses and minuses. So when you inhale cannabis, you can cause irritation to the lungs, like I was saying before. It can cause chronic bronchitis. But the good thing about inhaling cannabis is that it is very easily titratable, or it affects you very quickly. So within about 5 or 10 minutes of inhaling cannabis, you'll notice an effect. If you don't notice an effect, then you just inhale some more, and so you so you can really titrate the effect of the medication to your liking. And the other effect of inhaling it is that it only lasts for about an hour or 2 hours. So whether or not it's a plus or minus is that it'll come off shortly if you don't like the effect, or it won't last long enough if you do like the effect of the cannabis. The other form is orally. So this is a way that I recommend not taking to my patients, because the way that cannabis is absorbed orally and in your stomach is very variable depending on what is in your stomach. So if you don't have anything in your stomach, a lot of it's going to be absorbed. If you eat a fatty food, a lot more will be absorbed. If you don't eat a fatty food, then less of it will be absorbed. So it's really variable in the amount that gets absorbed orally. One of the other things is that, like I was alluding to in the previous slide, is that THC gets converted to a component of THC that is 4 times more psychogenically active when you eat it. So when you absorb THC in your stomach, all of that goes straight to your liver and gets converted to this very high psychogenic type of THC. So a lot of my patients aren't looking for the psychogenic effect, they're looking for what the benefits are, like pain relief. So I always tell patients to try to avoid the oral formulations of cannabis. The sublingual or the oral mucosal, the way that it gets absorbed in your mouth, if you have drops of oil or a lozenge that it gets absorbed in your mouth, it's the way that I prefer to tell patients to take cannabis, because it doesn't have that respiratory effect. It doesn't cause the chronic bronchitis. It doesn't cause the irritation to the lungs. And it doesn't have the variability that you have when you eat it. So the amount that gets absorbed in your mouth is very consistent, and it has a very consistent duration of effect. It doesn't quite have an effect as quickly as inhaling cannabis. It takes about 15 to 25 minutes for you to start having an effect when you administer it sublingually. But it does have a little bit longer of an effect than inhaling, so it lasts about 4 to 5 hours. And let me go back to oral. So when you eat it, like I said, it can really have there's a broad spectrum of when it will start to exert its effect. So it could be 45 minutes, it could be an hour and a half, it could be 2 hours, depending on what's in your stomach and what you've eaten. And then it can also last a significant amount of time. It can last up to 6 to 8 hours, sometimes 12 hours. And if you don't feel good with the cannabis, you're basically stuck with that for the next 12 hours, 10, 12 hours. The last way that you can take cannabis is topically. Less is known about how that is absorbed and the timing of topical formulations of cannabis, but theoretically it will take longer for you to absorb the cannabis through your skin, and it's much more difficult to titrate topical formulations to effect. So this is an example of what you might see in a cannabis dispensary, or the type of cannabis that you might find on the shelf. Most cannabis formulations are high in THC because it's mainly used by young people who are using it recreationally. But more and more formulations are being geared towards medicine. Here you see a formulation that's very high in THC. It's 22% THC, and the CBD content is only 0.03%. So this formulation is really going to have one of those psychogenic, make you feel high effect, which is accompanied by all those adverse effects of cannabis too, which it could be paranoia, it could be anxiety. So these are some of the take-home points for patients who I see in my pain clinic and they want to try cannabis for pain. So I usually like to use the proper term for cannabis instead of using marijuana. I call it cannabis. It affects our endocannabinoid system. Usually I tell people who want to just use it for pain to find a product that is higher in CBD concentration. So at least 20 to 1, 20 times higher level of CBD to THC. It is very well tolerated. You don't have those adverse effects that you get with THC. But some of the pain relieving effects could be coming from the THC. So if they've taken these products and they're not really having a good effect, or it's not really helping to reduce their pain, then I tell them to try to bump up the THC content a little bit, but still have a content that's higher in CBD than THC to avoid any of those psychogenic effects. I always tell patients to avoid the edible versions of cannabis and to try either the inhaled or the sublingual versions. But I usually err on the side of the sublingual because of the respiratory effects that cannabis can have. So these are some of the resources that are good if you're interested in trying cannabis. We have a very large center in the University of California system. A lot of research has come out of UC San Diego. We have a research center at UCI, and then there's also another research center at UCLA and UCSF. And we're continually building data and research to help support its use for our patients and to identify what are the good clinical indications for the use of cannabis. Another resource that is available is this book called The Health Effects of Cannabis and Cannabinoids. And this book is published every 10 years and was most recently published in 2017. And it really goes over about 10,000 systematic reviews on cannabis and the various health conditions that it's been researched on. And it's a very good book if you're interested in learning more about cannabis and cannabinoids and how it can help. Other resources that are good are the Canadian Consortium for the Investigation of Cannabinoids, and also the District of Columbia's Department of Health also has a lot of information on cannabis and cannabinoids. So at UCI, with our future research, we have a lot of research that we're trying to get started at UC Irvine. Me in particular, I'm trying to study cannabis and its intoxication and how do we identify it for people that are driving. Its use as an adjuvant to help reduce opioids. As we know, we have a very large opioid epidemic that is getting worse and worse and killing more and more of our people. on a daily basis. I am also working on research to identify biomarkers for pain and to objectively measure the pain relief that cannabis could provide. And I'm also looking at cannabinoids for the geriatric population as well. And now if anybody has any questions.
What about your book? The book you talked about.
This book? Here.
Where's it available?
So the question is, what about the book? So the book is called The Health Effects of Cannabis and Cannabinoids, and it's put out by the Academy of Sciences. And it's published every 10 years, and the last one was in 2017.
Available on Amazon?
I'm pretty sure it's available on Amazon, but I can't guarantee that. Yeah.
Is CBD its short name, the acronym for cannabinoids?
So the question is CBD the short for cannabinoids? Actually, so cannabinoids is the umbrella term for all cannabinoids, and underneath that umbrella is THC and CBD. And CBD is just the abbreviation for cannabidiol. THC is the abbreviation for tetrahydrocannabinol, and those are just the active cannabinoids that we're talking about. Yeah.
You mentioned that it has a negative effect on kidney function. Is that a temporary, or is that something that can exacerbate a chronic kidney disease, make it worse?
So the question was, I mentioned that it has a negative effect on kidney function, and is it an acute effect or a chronic effect? Yeah. So the literature on actually the kidney function itself, there's not very much research to say that it actually has an effect on kidney function. I just mentioned it as a thing to look out for, to be concerned about if you do have chronic kidney disease or if you have kidney failure. If you take cannabis, there's potential for it not to be cleared as rapidly in people who have kidney disease. It doesn't have an actual...
It has to do with the clearing.
Yeah, it doesn't have an actual detrimental effect on kidney function per se, or actually has not been, there's no studies or research that has been done to show that it directly affects the kidney.
What about other aspects of blood chemistry?
So, that is a good question. I don't think there has been, so the question is there any effect on any other aspects of blood chemistry? And based on the research that we have, there's really no studies that have been looking at that in particular. So I can't really comment on that. Here.
There seem to be no directions on the bottles or the jars on how much you should take and what strength it should be. It could be.
Right. So the question is, there's no directions on the bottle, and how much should I take? What should the strength be? Those are very good. That's a very good question. So like Dr. Lawton was saying, is that this medication, or cannabis in general, has not gone through the rigorous testing that the FDA requires for most pharmaceutical agents. So there is no real recommendations in terms of dosing, and in terms of what is the right concentration, what is the right amount to take. What I tell my patients is that it is really a kind of a trial and error for people to see, what is the right amount, what is the right formulation to take. To err on the side of safety, we tell patients that if you do want to try cannabis, you should try obviously lower doses of cannabis. and higher concentrations of CBD. And then you kind of have to work with your physician to guide you into, this isn't helping me, so what is the next dose or concentration I should take or try? Unfortunately, a lot of the studies that we have done are using various formulations of cannabis, and it hasn't been standardized. And that's why we need to research these compounds more. But that is a very good question, and unfortunately, I don't have the right answer to it because we don't have the research.
There's no control by the government on quality control. If they say it's 500 milligrams, it could be anything, really.
Right. So, at least in California, it's controlled by the Bureau of Cannabis Control. So what they've done is they are now requiring that they test all these different formulations of cannabis to make sure, well, number one, there's no pesticides in them or any other toxins. The other thing is they want to make sure that the content is what they say is on the label. Now, there are still probably some dispensaries that are selling cannabis that haven't gone through all that rigorous testing, but there should be at least some certification on the product that you're buying that says this has been tested by the Bureau of Cannabis Control in California, at least. But federally, yes, you're right. There's no regulation on it. Sorry. Why don't you get you, and then I'll go to you.
I have spinal stenosis and degenerative arthritis, and I took an over-the-counter anti-inflammatory, which gave me TIAs, but it worked. I use a tilt table, I use hot and cold, and I use topical, and it's helping less and less. Are you looking for clinical people to study?
Yeah, so the question is, so this gentleman here has spinal stenosis, and what was the other?
Degenerative arthritis.
Degenerative arthritis in his lower back?
Yes, L1 through 5.
L1 through 5, and he's been taking over-the-counter anti-inflammatories, right?
Yes.
That's been causing him to have TIAs. And he uses it four times.
I stopped taking it 4 years ago.
You stopped taking good. You stopped taking it 4 years ago, and you've been using topical.
Yeah.
And it's having less and less of an effect. Would cannabis be good for you? Is that your main question? So, and is there? Am I looking for patients to test these medications on? Well, so number one, the federal government doesn't allow us to really use it and test people and research subjects. Only specific institutions with certain grants are able to administer cannabis legally. Do I think that cannabis can have an effect for you? I think potentially it can help with your pain. Anti-inflammatories are helpful for you, and like I was saying, the cannabidiol or CBD can have an effect on inflammation. But I don't know your whole medical history, and do you have heart disease and kidney disease, and so I'd have to really, go over everything with you before I would say it would be good for you to take.
I have none of those.
You have none.
My doctor once told me I was past my expiration date.
Yeah.
More recently, he told me I'm going to live to be 100.
With pain.
Yeah.
Can you speak to the use of cannabis for curing alcoholism?
Ooh.
So the question is the use of cannabis for curing alcoholism. I am not aware of any studies that have looked at using cannabis for alcoholism, to be honest with you. I'm not entirely certain that it would be helpful or not helpful. It's just, that's a good question. Maybe we should be doing a study on alcoholism and cannabis.
You should be.
Yeah.
I've heard a lot of drunks say that it's gotten them off drinking.
Yeah?
Really?
Oh, that's interesting. Yeah.
Is the cannabis that you, the CBD that you buy at drugstores, is this the same type of the CBD that you're talking about, or is that a whole different ballpark? Or where would you buy it, the CBD that you're talking about, you're making reference to?
Like lozenges.
Like lozenges, yeah. So the question is the CBD the same CBD that you get in you get them in pharmacies or
CVS is good.
CVS's,
Grocery stores.
grocery stores,
Grocery stores.
Mother's grocery store? I would.
So it says CBD.
It's a
right
CBD on there?
Those drops, they have different degrees of it, and they have
Yeah.
the lotion, they have the whole works.
Yeah, I can't really comment on it because I don't know the products that you're talking about. It most likely is the same CBD I'm talking about though. I know that they're infusing CBD in all sorts of things, like lotions and drinks and all sorts of things. So I think that it is the same CBD that I'm talking about here. But I actually, maybe I need to go to Mother's and look at some of these products that they're selling.
Where would you buy it?
So there are also dispensaries, right? So there are cannabis dispensaries that
My daughter.
patients go to buy CBD or THC or cannabis products. And that's typically where I would tell somebody who's interested in going to using cannabis to go. I know in Fullerton, I don't think they have dispensaries here, but in Costa Mesa, I think in Orange, Santa Ana, there are a lot of dispensaries that sell both CBD and THC products. Sorry, this person way back there.
Addictive properties between cannabis and opioids?
So the addictive potential of cannabis and opioids, so is the question. And so opioids are much more addictive than cannabis. There is still some addictive potential for cannabis though, because when THC exerts its effect, it gives you that euphoric feeling. So in some people, and we believe there's some genetic component as well, there is a higher level of addiction potential, but it's much lower than in opioids.
Would you be able to proffer a guess as to the percentage of pain doctors who would allow or recommend cannabis to the patient? Is it a very small percentage? Do all of them do this?
So the question is, what is the percentage of pain doctors that would recommend cannabis, or would they not recommend cannabis? So that's a very good question. There are some pain doctors that will, some pain doctors that won't. Let me just tell you this lecture that I went to at a recent national meeting for pain doctors. And one of the questions was, what is the legal ramifications for pain doctors if they recommend cannabis? And unfortunately, if a pain doctor sees that you're on opioids and you're on cannabis, because there is no real evidence or research to say that it's safe for you to use both, and one of them is a federally illegal drug, If something happens to you, and I'm not saying that anything's gonna happen to you, but say something like you get in a car accident, and they test you and you're positive for both THC and opioids, the pain doctor can be prosecuted for that, because it is, unfortunately, because of the law, as they say, it's irresponsible for you to be continuing to prescribe opioids while you also know that you're taking cannabis. So there is a lot of legal ramifications for pain doctors. But some of them will recommend it if you're not taking other pain medications like opioids. And I think that is mainly my practice, is that I try to, if somebody is interested in cannabis, I tell them that, well, if you're taking opioids for pain and you want to try cannabis, you either have to pick opioids or cannabis. But that is different between all pain doctors in California and across the country, is that every state has a different law. But at least for the federal government, it's still illegal. So there's that legal ramification that we as pain doctors have to understand.
And so if you travel from state to state, it would be illegal to take your prescription from California to a state that does not allow CBD.
Correct.
And can the dogs sniff?
The question is, can the dog sniff the cannabis? Yes.
Yes, he can.
Yeah, they
When you get off
can.
the plane, can they sniff the little droplets that you put under your tongue, and can you go to jail for that?
Yeah, so most of the airports are federally regulated, right? The TSA people are federal employees, and if they find cannabis, it's illegal to have cannabis.
But how
Right.
likely is that liquid to smell? I mean, to be able to.
I can't answer that question, I'm sorry.
So you're kind of in a bind for those who find it to be helpful. They can't travel. They have to make sure they go from one state to another state and not on a plane.
Actually,
Very sad.
That's not true.
actually, LAX a few months ago announced that you are allowed to travel even with with cannabis that's smokable, but not every airport has said that you can bring it in, or that you can fly in with it, or that you can drive in with it and get on a plane, so you have to know where you're going as well. And CBD, depending on what you've looked at, there are some brands like Charlotte's Web. They claim that their CBD is legal in all 50 states, and then some CBD is not. It is a far trickier issue getting what's legal and getting what's tested. And in fact, most of the dispensaries you go to probably are not licensed, like by the city, and so it's much, much trickier than you would think. But there are some airports where you can take
There's some.
flower.
Restaurants I like have an A in the window. Do you have any commentary on how to assess the dispensary?
Yeah.
And what its qualifications are? Is there an A in the window?
I don't. So the question is there any way to rate the dispensaries and what the quality of the dispensaries are? I know of no rating system for the dispensaries other than what's on Google and Yelp, but yeah.
Sorry, only one more thing.
Yes.
There are actually only 18 state licensed dispensaries in Orange County, and all of them are in Santa Ana. I just looked them up and emailed every single one of them last night. Leafly is your directory for legal dispensaries.
So you could just
Leafly.com.
legal dispensaries or something?
Leafly.com is current. Leaf, like, can you say it from the mic?
Leafly?
Yes, leaf, like a leaf on a tree.
Leaf?
Leafly.
Oh, leaf?
.com. Yeah, and
So it's the website she's talking about is called Leafly, LEAFLY.com.
Yes,
I
correct.
did not know this information, but I'm glad somebody here is an expert in dispensaries here.
There are lots of directories online, like weedmaps.com, but there's nothing on there that indicates whether it is a licensed dispensary or not. And of the 34 cities in Orange County, Santa Ana is the only one that has said it will allow that it will give licenses to dispensaries. So you go to unlicensed ones in Fullerton, Brea, wherever, at your own risk in terms of verified products.
So
That's
she
the
said
best I can tell you.
that she said that there's 18 licensed dispensaries in Southern California, and they're all in Santa Ana.
In Orange County.
In Orange County.
Yeah.
In Orange County. And they're all in Santa Ana. So if you're going to a dispensary outside of Santa Ana, then it's probably not licensed.
Does that mean all in Santa Ana are licensed?
So it gets licensed by the Bureau of Cannabis Control, so the state of California.
I'm happy to talk to you after.
Yeah.
Just grab me.
Could I ask, if you go into a dispensary and you ask them, are they licensed? Are they obliged to tell you?
I wouldn't ask.
Because you want to go into a licensed place.
Right.
Right.
So it makes sense to me that if you do go into a dispensary, ask them if you're licensed, and whether they'll tell you, I don't know.
Say something.
Yeah, I think they're unlikely to help you.
My experience is that it's not so much the issue of being licensed as to the products they carry, because they carry the same products. You can go in and get edibles, but one company makes a much stronger edible than another company, and sometimes they don't mix it well, and you'll get something that does not have what you need. I am a patient that has 4 pretty intractable pain diseases: ankylosing spondylitis, Ehlers-Danlos syndrome, fibromyalgia, and neuropathy. I cannot take anti-inflammatories. Nothing like that works for me on the market. I had 2, I had a narcotic for a migraine one day. I was in the hospital for 4 days. I cannot take any opioids, would not even get near them. And finally my doctor said, if you need any pain relief, this is all that's left for me. I exercise twice a day. Activity is my big thing. I will not use marijuana in the day because I will not be compromised. Mentally driving, it's an ethical thing for me. But at night, if I don't have an edible, I would literally not sleep all night. But you mentioned neuroprotective. So my question to you, and probably to a number of us in here, especially if we have to use this medication, is it neuroprotective from dementia? You have this temporary memory loss. It is temporary, but this is
From
always a
Alzheimer's.
concern
Yeah.
at this age, whatever medication we take.
Right, so the question is it neuroprotective for Alzheimer's? And we don't have the research to support that, but there is studies that are going on now that are, at least in preclinical models like mice, that show that maybe it's helpful in Alzheimer's, but to be honest, I can't say that it is,
Correct.
right?
Okay.
And we need to do more research. So if you guys all want to enroll in some research, that would be great.
Can you take people with multiple diseases?
Yeah, yes, we can, yeah.
All the people.
Yeah. Way back there, yeah.
Cannabinoids seem to have so many different effects. What's the normal, you talk about the cannabinoid system, but what is the endogenous compound in your body and where is it made?
Right. All right, so it's that's a good question. So I talk about the endocannabinoid system and what is the endogenous compound that is made, and where is it made. So we know that endocannabinoids are made throughout our bodies and in different areas. It's made from the cells that we are digesting in our body. But what are they? So there are different names for them. There's a lot of different endocannabinoids, and they all have different names, and they all have different functions. And there are actually endocannabinoids that you can buy on the market, and GNC and Amazon. And there's some thought that the endocannabinoids are also helpful for all these different types of things too. One of them is called PEA, called palmitoylethanolamide. Another one's called anandamide. I'm probably not saying that right either. But yeah, I mean, I don't know if that answered your question, but endocannabinoids are just normally made throughout your body, and they use components of cell membranes and enzymes create these endocannabinoids in your human body. I don't know if that answered your question. Did that answer your question? I don't know.
I was thinking there might be certain types of cells. Are these nerve cells? Are these
yeah, they're just
immune cells?
They're not actually cells. They're really proteins.
No, that make.
Oh, so there are enzymes that cleave proteins that create these endocannabinoids. So they're not actually cells. They're just proteins that exert an effect on certain receptors in your body.
No, I know that. I'm just wondering what cells made these compounds that are
Naturally?
that are endogenous to your body that are being synthesized. Most of these compounds that have receptors are compounds that your body makes, like opioids and all the neurotransmitters. So
I don't know the answer to that. I'm sorry. I don't know what cells make endocannabinoid.
I have a question on the way you take it. There's, like, you can smoke it, and then there's this oil that you can inhale. And yeah, what's it?
A vape, like
A vape. Okay. Is the smoke, because you're inhaling both of them, correct?
Yes.
Is the tobacco or whatever, the leaf, is that more effective than the oil or vice versa?
So the question is inhaling cannabis in the different forms. So there's you can smoke it, like you can smoke the plant, or you can get like an oil that you vaporize. So vaporizing is a cleaner way to consume cannabis. When you smoke it, you're also smoking all the other carcinogens when you basically burn the plant. When you vaporize it, it just basically heats the oil or liquid up, and then creates a vapor that's much cleaner. It doesn't have as much toxins. Actually, probably around 80% less toxins in when you're vaporizing cannabis as opposed to when you're smoking it.
Is one more effective than the other?
No. Well, let me backtrack on that. So you're going to get a higher percentage of THC in the smoke when you vaporize it. Well, it's not really smoke, but when you vaporize it, you're going to get a higher percentage of the THC or CBD than if you smoke it. So it is probably more effective to vaporize than to smoke it. Yeah.
There was an article recently in the LA Times about the contaminants. Sometimes vaporized pins from China are full of lead and things like that. Do the tested, the certified or licensed dispensaries, are they going to be less likely to have toxins in the delivery system, the vaporizing pins? Will they have
The
checked
cartridges,
that?
do you know what she's talking about?
I
The cartridges?
know what she's talking about, but
But I don't know the answer
I don't know
right
the
now.
answer to the question. I know that
Exactly.
So
That
we
is
don't
a-
know if the state checks for that when they license to make sure they're not selling.
I don't think it's a dispensary licensing issue, it's a manufacturing issue, and I don't have the answer on whose stuff
Whose
is.
checks.
Right, yeah, who's good. I'd have to research it.
Yeah, I'm sorry, I don't have that answer either. Yeah, you can ask that question.
No, I have a question about fibromyalgia.
Yeah.
And how effective have you found it in your studies, to use some form of cannabis? And which form would be the most effective in terms of pain for fibromyalgia?
Right, so fibromyalgia is a very difficult pain condition. It's a centralized pain condition. But the question is about fibromyalgia and cannabis and the effectiveness of it. There have been limited studies on fibromyalgia. The amount of subjects is low, but have shown some effect on fibromyalgia. Approximately 20 or 30% reduction in pain. And as for the type of cannabis, I believe that the type of cannabis they were using was a sublingual spray of oil under the tongue. But like I was saying, it's really not a standardized formulation that all these studies are using. They're all using a different type of cannabis with different concentrations of CBD and THC. So you really kind of have to, it's really, unfortunately, it's a trial and error type of thing to see what is the right formulation for you, how much should you be taking. The guidelines we usually give are, again, you try the lowest amount first, with the highest amount of CBD, and you kind of work your way stepwise from there. You have another question?
Amazon, in the last 2 months, have come up with CBD, dozens and dozens of manufacturers, ranging in strengths from 100 to 5,000 plus. And it's a dispensary as opposed to a pharmacy. Would you get the same quality, same strengths that you? Are you dealing with somebody that is making it in his garage and they don't even have a quality assessment?
Yes, sometimes yes. The reason why you're seeing not a glut, but so many CBD products come out is because the Farm Bill was passed at the federal level. Did you address that? Yeah, which makes hemp agriculture rather than a drug, but that does not mean that it's not a guy in his garage. It doesn't mean that.
So what she's talking about is the Farm Bill was recently passed, which allows for people to cultivate hemp to manufacture CBD because it has less than 0.3% THC in hemp. So, yeah, I mean, the question that you were having is the amount of CBD that you get on Amazon the same as what you get in like a dispensary? Right. Yeah.
Or a pharmacy.
Or a pharmacy. It should be the same. Right? I don't think there is any difference.
Actually, I have a question for you. It's related. Two questions. One is the research dividing isolates versus full spectrum CBD? And if you address that, I apologize. Just skip it. And the second question is, I met two gentlemen from Switzerland at a conference, and they said that they're using CBD to help people who are addicted to THC get off it. And I mean, in the United States, you would never, ever, ever hear a person say that THC is addictive, although I mean, everything's addictive, but is that anything that's being looked at or divided? I don't have the words for it right now, but so isolates versus full spectrum.
Yeah, the question is, the question is isolates, specifically like the different components of the cannabis plant, like THC, CBD, or other minor cannabinoids. Is the research being done on the specific isolates, or is it being done on the full spectrum plant, which means that we're using the entire plant, and that means THC, CBD, and all of the other cannabinoids in it. And I think at UC San Diego, they were using NIH cannabis that was smoked, and that would be full spectrum, right? But for us at UCI, we haven't started using the isolates or the CBD or even the full spectrum on human subjects yet. Mainly it's been on preclinical, like mouse models at this point in time, because of the difficulty with getting it past the federal regulations. But we hope to use the isolates, like just CBD, just THC, just some of the minor cannabinoids like THCA, eventually in our future studies. And then the second question was?
THC addiction.
THC, like cannabis use disorder, and using CBD to help to treat THC addiction. So I know that at UCLA, there's a physician named Ziba Cooper who's looking at cannabis use disorder specifically. And I'm not sure if she's using CBD to help treat it. But I am personally not working on any of that type of research. Mainly my focus of research right now is to help to identify THC intoxication, to help to identify specific pain types that are treated with certain cannabinoids, and maybe to help prevent some of the neuropathic pain that arises in certain conditions like diabetes and chemotherapy. Yeah. Jerry?
How close are you to having a test on the road for drivers to detect whether or not they are intoxicated with THC? How close is it?
So the question is, how close are we to developing a test to see if people are intoxicated with THC? And the answer is not very close, I don't think. A lot of the reason is because THC and cannabis and cannabinoids their properties are much different than like alcohol per se. So alcohol is very hydrophilic, or is very absorbable in water. And THC and CBD are very lipophilic, or absorbable in fat. So what happens when you drink alcohol, and a lot of the research or the idea behind trying to find out whether somebody is intoxicated by THC, they're using methods that they used for alcohol. And unfortunately, it doesn't work the same way because they're two different drugs. With alcohol, you can use a breathalyzer, you can check your blood, and a lot of the alcohol will stay in the bloodstream. And there's a direct correlation between the amount that's in your blood or in your breath to how much is in your brain. But that's different than THC in that because it's absorbed so quickly by fat, once it gets into your bloodstream, it very quickly moves to areas of fat. So like in your brain or subcutaneous tissue or your organs. So the amount that's in your blood is much, much lower than potentially what's affecting your brain. So, a lot of the methods right now are looking at blood or urine or your breath, but it's not an accurate reflection of what's in your brain.
Okay. Because Dr. Yeung has some other responsibilities, one last question.
Next steps, if you have pain, what are the 2 next steps you should do?
What was the question?
If you have pain that could be better by TBD, what would you recommend as the next steps for any of us here in that category to take?
So the next steps, the question is, what are the next steps to take if you think that cannabis can be helpful for your pain? So the first thing I would do is, speak with your primary care physician and make sure that all the things I was talking about, your cardiovascular system, your respiratory system, and the medications that you're taking aren't going to interact or have a detrimental effect on your own health or the effect of the medications that you're currently taking. The second thing would be if they don't have, like the primary care physician doesn't really have any recommendations for you in terms of the type of cannabis to take, I would go see a pain doctor and see whether they have any ideas or thoughts about what type of cannabis to try, specifically for your type of pain. Because all pain is not created equal. There are different types of pain, right? So there's pain that could be coming from your spine, there could be inflammatory pain that are coming from your joints, it could be centralized pain like fibromyalgia. So the different components and the different makeup of the cannabis should be tailored to your type of pain condition if that's a route that you're interested in taking. And again, it all comes with the caveat that there isn't the rigorous testing that normal medications take, like through the FDA, to make sure that it's safe and effective for your condition. So that gap that I'm talking about, or I talked about at the beginning, needs to be filled with some research to show that it's helpful. But in the meantime, we just have to work with what we have.
Okay, last question.
Last question. That's you.
Can cannabis be used to detox from opiates?
So can cannabis be used to detox from opioids? So there has been a lot of studies that show that it potentially has an opioid sparing effect. It has an opioid sparing effect. Cannabis. So, and it potentially can have an effect on withdrawal symptoms from opioids. So I think that what the question was is that can cannabis help to reduce opioids? Is that what you're trying to say? Yeah. So, and mechanistically, when we look at the endocannabinoid system and the opioid system, they kind of work in conjunction with one another. So where I feel that opioids in combination with, activation of the endocannabinoid system can have a synergistic effect on pain. That's just my own personal thought. There's more research and needs to be done on opioids and cannabis, specifically together. But there's no definitive literature to show that yet.
Thank you so much. What a great presentation. And obviously, there's no interest in cannabis in the senior population. I would venture to say there's more experience in this room with the use of cannabis than most other segments of the population. Again, coming up on April 10th, Dr. Jim Pearl is going to be at Morningside at 7 in the evening, and he's going to be talking about drug trials. Yeah. And maybe it'll be interesting to ask him about cannabis drug trials, because it's a very relevant subject. And then the only other comment is don't forget April 13th, downtown, great jazz at noon. And it's a class, so you get 3 units for that class. Peggy Lee and Doris Day, we're going to be doing all their music. Again, Brent, thank you so much for doing a great job and sacrifice of time. It's great. Okay, see you next time.